Start the equipment. Turn on the main power switch. After the device started successfully, the login interface will appear. Enter the username S and password S and click on the login button. Note, all letters entered are lowercase. After entering the system, click on Patient at the top right of the screen. Then the patient information interface appears. Items marked with an asterisk must be filled in. Input the required information and click on New to complete the information entering. Ask the patient to lie in a supine position on the examination bed with the right arm lifted above the head. Bend the body slightly to the left to fully expand the intercostal space.
When the patient gets ready, perform image-guided positioning by using the ultrasound probe. Start the image-guided positioning. Hold the probe in the right hand with the thumb on one side. Keep the thumb and the raised dot on the probe in the same direction. Apply an appropriate amount of coupling gel on the surface of the ultrasound probe.
Select the detection position of the lever between the 7th to the 9th intercostal space by starting from the xiphoid and going down to the right.
The ultrasound probe shall be perpendicular to the patient's body surface. The end with the raised dot is the front of the probe. The image scanned starts from the left side of the screen. For image positioning, locate the outline of the liver capsule to ensure that the liver area is scanned. Move the probe along the intercostal space or adjacent intercostal spaces to ensure that the liver parenchyma is uniformly located under the probe centerline. Avoid large blood vessels, hepatic cysts, and other organ to obtain more accurate values. The appropriate positioning criteria are uniform liver parenchyma below the probe centerline, within dotted line, with no cysts, large blood vessels, ribs, or other non-liver tissues. After reaching the proper location, tap the snapshot button on the screen to take a screenshot of the current image. Multiple images can be saved. And mark the center point of the probe. Then tap the elastography button on the screen to switch to the fibrosis scanning mode.
After confirming the examination location, apply a proper amount of coupling gel on the surface of the probe and place the probe at the determined lever detection position. Hold the probe with the right hand, make it close to the skin, and the probe must be perpendicular to the skin surface. Rest your right hand elbow against the bed to prevent the probe from sliding. Hold the end of the probe with the left hand in order to adjust the angle. When entering the lever examination mode, the probe pressure indicator bar is at the top left of the interface. The pink color represents insufficient pressure. The red color represents excessive pressure, and the green color represents suitable pressure. The middle is the image area. The left side M mode represents the collection of A mode signals during a period of time. A mode represents the liver tissue signals acquired by the sensor at a single time point. The right side E mode represents the transmission of shear wave in the tissues. The examination results are displayed at the lower part of the screen. The ultrasound attenuation parameter is displayed on the left. The liver stiffness value is displayed in the middle, and the success rate is displayed on the right. During the examination, pay attention to the pressure indicator bar. Generally, it is required to remain in the green range. Step on the foot switch for measurement. During the examination, the image brightness of M mode should be uniform in different depths, and the image should show steady layers. For A mode, the signal should not shake fiercely and rapidly in different depths. For E mode, the image should show a regular strip pattern. Each step of the foot switch is counted as one measurement. As a valid diagnosis, there should be at least 10 successful measurements with success rate higher than 60%. IQR over median is less than 33%. If you would like to restart the measurement during the operation, click on Clear on the screen to delete the data being measured. If it is required to modify the patient information, click on the Modify icon to change the corresponding information. After measurements are completed, click on Up or Down on the screen to select the images for printing on the examination report. Select a good image and click Print. The report is printed while being displayed on the screen.
When an ultrasound image is saved, it will be printed out as part of the report.
If printing is not required, click the Save icon at the top left of the report to save the examination results. For inquiries of histories, click on Search at the top right of the screen and go through all the examination history records by keywords or page by page. Finally, click Log Out at the top right of the screen to return to the login interface. Then click on Shut Down at the top right of the login interface and select Yes to shut down the device.